We work with thousands of clients each year, and the one thing that everyone needs to do before you can even begin to select a Medicare plan, enroll, take care of everything is go ahead and enroll in Medicare Part A and Part B. So most people choose to do this as ssa.gov. You can also do it at the Social Security office. But we're going to talk today about the four main hangups that people experience when enrolling in Medicare. Now, at the end, you'll want to stick around. If you're going to choose to work past 65 and enroll in Medicare after 65, we'll cover that one at the end. But let's go ahead and get started. The first thing that you'll need to do is create a My Social Security account if you haven't already done so. It's important to note here that if you created an account prior to September 18th of 2021, you'll use that login, the username and password that you created then. But for everyone else, we're just going to go ahead and assume that you're creating an account for the first time. So let's kind of dive into it. Now, first, before we do, this really is fairly easy to do. It should take you 5 to 10 minutes at most. So you'll see right here, we are on ssa.gov. That's the website that you need to be on. And then in the top right corner, you'll see the sign in button. Go ahead and click that. And then it'll take you to this page, and you're going to want to click create an account with login.gov. And then from there, create an account. Now you do need to put in your own unique email address. If you and your spouse share an email, I'd really recommend you have a second one. Select your language preference, accept read and accept the login.gov information, and then click submit. Now the thing two things worth noting here is you do need to have your cell phone ready for a verification code, and then if the activation code only if applicable. But most of the steps here are self-explanatory, but if you do run into trouble, I would recommend that you call Social Security directly at their main line and they can help you out. And that number is 800-772-1213. All right, great. So you went ahead and you created your My Social Security account, and now you can move forward with enrolling in the Part A or Part B when you're ready. And this, again, is a pretty easy process, but it might take 10 to 30 minutes or so. So before we kind of dive in, I want to specifically show you, this process that we're going to show you here, it applies to you if you can see on here, if you are in your Medicare initial enrollment period referred to as IEP. And so as a reminder, that is the 7-month period that includes the 3 months before the month you turn 65, the month you turn 65, and then the 3 months after your birth month. And this only applies to you if you do not have Part A and Part B already. So kind of to say that a different way, 3 instances where this does not apply to you is, number one, if you're already drawing your Social Security benefit and you're under the age of 65, this won't apply to you because they're just automatically going to send you your Medicare card when you turn 65. So just look for that in the mail. Number two, if you're working past 65 and delaying Medicare, this step-by-step process will be different. So you can just kind of skip ahead as we're going to cover that later. And number three, if you don't have 10 years of work experience, but your spouse does, you'll need to enroll using your spouse's work record. So it's a bit of a different process. And the way that they do this is it's based on 40 quarters that you've worked. So if you haven't worked those 40 quarters, then you'll draw off of your spouse's 40 quarters. I just want to show you a couple more steps first. So you're going to go, but we're back, you'll see here, we're on ssa.gov. You'll see right in the middle of either at the top at Medicare, and you can click the down and click sign up for Medicare, or you'll see it's also in the middle of the screen here, but go ahead and click on that. And then from there, you have two options. You can sign up for Medicare Part A or Medicare Part A and Part B. Now, we're going to get to this lower portion here in just a second. A quick reminder about Medicare Part A. A lot of people that turn 65 and continue to work take Medicare Part A since there is no premium associated with it. We actually have a video on this and things that you might want to consider, especially if you're on a health savings account, etc. So go ahead and back to our YouTube page and check out the video on that if you have further questions. Or you could also, as you see right here, sign up for Part B only if you already have Part A. So let's go ahead and click there, apply online. And you'll see here, there is a checklist here of information that you should probably have available before you really continue any further, just because it'll help make the process quicker, and that way you know what you need before you kind of dive on in. So go ahead and once you understand, click I understand and then next. All right, so then you're going to end up on this page where you can go ahead and start a new application. So click on that. And it will take you to this page, and you can select whether you're applying for yourself or you're helping someone. So I am applying for myself essentially. And yes, I already created my Social Security account because we just did that. And then you click next. All right, so now we've ended up back on this page, and you're going to click on the login.gov, just like we learned earlier when we established this. And I will be frank, the next few steps are pretty much just filling out your information, and it's very straightforward. So we're going to skip that because this also brings us to our first major hangup. All right, so we have come to our first major hangup. So on this page, essentially what's asking is if you only want to enroll in Medicare and not the Social Security benefits. So if you're truly trying to take Medicare only, then you're going to select yes. If you want to take Medicare and your Social Security benefits, then you're going to select no. And if you do, there are additional self-explanatory questions that you're going to have to go through. It'll probably take around 10 extra minutes to complete, and then you'll keep going with the Medicare enrollment. But for now, if you just keep going, you'll go ahead and get to this page. And this is your re-entry number. And it's useful if you get distracted, if you have to go do something and you need to return to your saved application, which then takes us to our second hangup. All right, here we go, the second one. Notice that there's no reference to Part A. And that's because this is assuming that you also want Part A when you're filling out the application. So a couple of things. If you want to enroll in just Part A, say you want to continue to work like I talked about just a few minutes ago, or you're on your spouse's coverage, then select no, because then you are getting Part A only. Now, if you wish to enroll in Part B, this is where you select it. You're going to pick, you're going to go ahead and click yes and have both of them. So this screen also asks if you're receiving Medicaid. Answer yes or no appropriately here. All right, on to our third major hangup. So this page asks if you're covered under a group health plan, and you have to be careful about how you answer this. If you click on the more info link for details about what they mean by group health plan, this link explains that's based on current employment. So that means that if you have COBRA or retiree coverage or a Marketplace Affordable Care Act health plan, you need to select no, because these are not based on current employment. But if you want to continue working and are on an employer health plan or will stay on your spouse's coverage, go ahead and select yes. Now, it's important to note that if you do so, make sure you don't sign up for Part B in the previous section, because Part B does have a monthly premium. I mentioned earlier that Part A does not, but Part B does. So you would be paying for your or your spouse's employer health plan premium plus your Part B premium. So if you did answer yes, then fill out this employment information as it makes sense. So let's go to the fourth hangup. All right, your fourth hangup is here, and this is the final application page and gives you the option to provide any additional information with your application. So let's give it a few examples. Example number one, if you're in your Medicare initial enrollment period that I referenced earlier, that 7-month period surrounding your 65th birthday, then you don't need to put anything in here. But example two, let's say you're 66 and enrolling in Medicare, so you're obviously not going to be in your initial enrollment period. You could add a note on when you want your Part B to start. So then from here, when you click next, you'll go to a page where you can review your information and make any changes before submitting. And again, if you're working after 65, you're going to have a different method of enrolling. So last, I want to emphasize that if you are enrolling in Medicare Part A and Part B, that is only original Medicare. And so I've talked in many different videos about how that leaves gaps. There's no out-of-pocket maximum. There's several different deductibles you'll have throughout the year. So there's just a whole variety of things. This is where we really recommend that you select either a Medicare Advantage or a supplement Medigap and Part D drug plan. Really, I would recommend that you talk to an expert about this. You can book a no-cost assessment with our team and be on your way to peace of mind without all of the unnecessary hours spent researching plan options. All right, so let's talk about what happens if you postpone Medicare and you enroll after 65. So earlier I talked about the initial enrollment period, those 7 months, et cetera. If you choose to stay on an employer plan or you have coverage through your spouse and you have remained on that coverage until, let's say, 66 as an example, and then at that point you choose to enroll in Medicare, you are going to need a couple of forms. And these are called Part B forms. We'll talk about them just one second. But the reason that you need these forms is that this will prove to Medicare that you had what's known as creditable coverage or coverage through an employer, and therefore you're not going to have to pay any type of late enrollment penalties. So these forms that I'm going to go ahead and talk about are what allow you to not have to worry about those penalties. All right, so now you're going to be in what's known as a special enrollment period or an SEP. So let's say, for example, that when you turn 65, you enrolled in Medicare Part A because there's no premium with that, and you stayed on your employer coverage, so you didn't yet take Part B. There are going to be 2 paper forms that you're going to need to then go ahead and enroll for your Part B. So first of that is for your Part B, if you go to ssa.gov and search 4040B as in boy, and that will go ahead and get your Part B kicked off. The second is your employment verification, and that one you're going to search for the letter L as in Lawrence, 564. And what that form does is it proves that you had what's known, and I've talked about earlier in this video, as creditable coverage. So that would be primarily, that one is focused on the drug coverage. So it's saying that since you turned 65, you had coverage through your employer that allowed you to stay on that. And therefore, when you do enroll in Medicare, you're not going to have any late enrollment penalties, whether it's for Part B or for your drugs, et cetera. So I would really recommend for these forms that you go to your employer, whether that's your HR team, your benefits team, and ask your employer, because typically they're the ones that fill these forms out for you. So ultimately, you can tell that this can get tricky. It can get overwhelming. I would really recommend that you sit down with an advisor, an expert, someone to talk through this process to make sure that you're getting everything that you need and you're doing things at the right time. You're not going to face any of these penalties, and that you're going to just essentially have the coverage that you need. When you do fill these forms out, then you'll go ahead and send them to Social Security. And from there, your Medicare will start the first of the month that you want it to, regardless of when your birthday is or anything like that. So as a reminder, again, this is just for Original Medicare. That's your Part A and Part B. It's the red, white, and blue card you receive from the government. But as a reminder, that really only covers, there's no maximum out of pocket. Generally, the rule is 80-20, but there's several different deductibles and things throughout the year. So most people do choose to take a Medicare Advantage or a Medicare Supplement and Part D drug plan to pair with this. At the end of the day, this is complicated. Get help. We're here to help you. There are advisors all over the country that can help you with issues like this. I just wanted to really cover these 4 main hangups because it's something that we see on a daily basis with all of our clients and all of the people coming in to work with us. And again, this really applies if you're in your IEP or the 7 months surrounding the month that you turn 65. Now, or those 2 forms are applicable and will apply to you if you are going to work past 65. But really, that gets complicated. Don't do it alone. Just call us. We're here to help.